So guys, I can now talk. I can now move my jaw. It's so good to be back. The whole of last week, the whole of this, my jaw was dead. All right, I lost sensation from here. Even till now, I still can't feel. I can't feel this finger I'm touching here. The whole of this place now, I still can't feel something here. So I'm gonna tell you why it happened. And I was in immense pain. Think of all the possible pain one person can feel. I was in such a pain last week. I could not sleep. I could not do nothing. I could not think. My brain was not working. Somebody sent me a voice note early last week. I couldn't listen to the voice note. Till yesterday, I could not, my brain could not process things. What happened was that I went to a dentist and they extracted a tooth. It's not like I needed to, but it was not like it was urgent. You understand? But the story of what brought me to that point is very important, and that's why I'm making this video. Make sure you watch till end, and make sure you click to share this video, and then follow me. All right. So it started like about 5 years ago. I was abroad, so I went to before I wanted to travel abroad. I realized that dentists have been telling me that the two last teeth on my jaw, the very last ones, they are not standing like the rest. You know, all your teeth is standing like all these teeth now. They are standing like this, but the last one is now bent. In dentistry, they call it impacted, all right? According to what I understand, it's bent. And it's a sign of evolution. You know, human jaw is going back, so the last teeth is always impacted. So the dentist told me that I have to remove them, otherwise they will accumulate plaque and debris and then rot and then spoil the other teeth because they are impacted. So before I traveled abroad, I was imagining that, you know the way US healthcare system is, that it's going to be so expensive. It's better I do it in Nigeria instead of doing it for $3,000 in US and stuff. So I went, hired a dentist, and then one early morning he did it. He did it before going to work. I went to his clinic. He has extracted the tooth. And he did it without painkillers because he wanted to inject me with a painkiller. I was like, nah, I'm tough, you know, just take out the tooth. He put his plier. After like 10-15 minutes, he lacerated inside, he cut inside, and was able to pull out the tooth. The tooth was bent. It was like C, you know, the tooth was like this. So you had to cut and then extract the tooth and then stitch me inside. This was 4 days before I traveled. So by day 4 that I was traveling, I was physically fit. Like, I was perfectly okay. So I traveled. When I now arrived, I went to a dentist again. And because the one that was removed was worse. So, and the dentist advised me in Nigeria I should remove this other one too, to avoid this other one causing me problems. So when I went to the dental clinic, they scanned me and they flew in a doctor from another city. The doctor came and looked at the scan and was like, this scan is not enough. X-ray is not enough. He said there's another machine they will use to scan again to check whether there's a nerve. He said there's a nerve that passed through this place to the front of your face, and sometimes that teeth that is impacted is sitting on the nerve. So he said if they remove that teeth anyhow, it could damage that nerve and you will lose sensation. So he told me, even though the x-ray is showing that yes, they can remove the tooth, that he wants to be sure that they need to scan with another machine, and that machine is not available in that clinic. So they have to do special requests for me to import the machine, or I will have to fly to the other city. So I was like, okay, this was 5 years ago. Since I'm not having any problem, I can manage it. So fast forward till about last month, all of a sudden I started having some kind of minor pain coming from there. I checked my teeth in the mirror. I knew that guy has finally started giving me small problem. And if you've gone through a dental pain, you will know that, man, you don't want it to be an emergency, especially on a Sunday or more. So I just planned for it. I went to the clinic here in Nigeria. They did x-ray. That machine, I don't know what they call it, dentist, you know what I'm talking about. That machine they were supposed to use to scan the second one, they did not scan it. They don't have it. So they just made judgment based on the x-ray. And I was telling the doctor the history of this other one, that abroad, though, they told me there's another machine that they will need to. He told me, don't worry. It's a good clinic, okay? So I'm not bad-mouthing the clinic. So I also told him that the other guy tried to pull out this teeth. It was so hard for him until he lacerated. He had to cut me inside before he could bring out the teeth. So the reason I was giving him this is to give him my full medical history, so he no go come struggle for here. I gave him everything. He now started to remove this one. First of all, gave me injection. Immediately they gave me injection, I lost sensation. The whole of this place, I wasn't feeling anything again. They started extracting the teeth. The teeth no gree come out. They pull, push, put plier, put screwdriver, put this one, put that one. My mouth was open for 2 to 3 hours. Jesus Christ. It was 3 hours total because I timed it. My mouth was open. Hand was inside my mouth. Clippers, screwdriver, this one, that spanner. Everything was inside. They were pouring liquid, everything, painkiller, I suffered. For 3 hours, the guy would try, he would stretch his hand. One of his hand would die, saying they put it. He tried. The lady, the nurse, dental nurse or whatever, was now pressing on my temple. I don't know why she was doing that, but I believe that it's to keep my mouth open. She pressed so hard that 90% of the headache I had after the surgery was from this lady pressing my. It remember make my skull burst open. She pressed like After everything, eventually they extracted the tooth. After every they used a certain machine to cut the teeth eventually and extracted the tooth. But they did not lacerate me like the other dentist did. That one, I think it was more like he has done it many times. He just knew that at a point he had to cut me. So, and I was okay with that doctor cutting me. I was like, if this thing no agree, you just cut me, And they pulled out the tooth. They now put cotton wool, everything, told me to rinse with salt and water, go home, gave me some medicine. That was the beginning of my problem. I was thinking my problem was over. When I got home, eventually the next day I started the salt and water, took the drugs. That night, not even the next day, that night, the headache I got that night, it was like 30 angry people were using hammer on my head. My eyes here was headache, my ear was headache, my jaws was headache. Damn, it was so bad at night. I was awake till around 2-3 in the night. I had to go and take the drug. I didn't wait till morning to take the painkillers they gave me. I took the drugs. It did not work. So I think I have to call some names here because the painkiller that was attached to the drug was cocodamol. Cocodamol, everybody that has spoken to told me that it was supposed to stop the pain. That is very powerful. I did not feel anything. I took cocodamol. I was awake the whole night. You know when you are so pained you can't sleep. In the morning I was feeling like I missed sleep, but the headache was still out of it. Was getting worse. Clock was so slow because I was at night watching the clock. The clock was so slow. The clock not they move again. Normal night that you close your eyes by 9 p.m. before you know it is 6 a.m. That night was like 3 days night. The next day I took another cocodamol. They told me I had to take it twice per day. It did not work. I had to go and take ibuprofen, 325 mg. 2, it did not work. I swear to God Almighty. Ibuprofen can't be like water. Ibuprofen no work. I had to take Panadol extra. By the evening of that, I was spacing it out. By evening, I took Panadol extra 2. It did not work. The headache was more every 1 hour. The thing is stopping. I was feeling pains in points on my face that I wasn't feeling pain before. There was one particular headache that was connecting like this to the back of my medulla oblongata. My head was scattering. Jesus Christ, see pain. And it was over a weekend. So it's not like you want to go to the clinic or anything. Damn. By Sunday, I was like, nah, this is not how I'm going to die. I had to drive out. I went to some pharmacy. I was like, I showed them the painkillers and said it's not working. They should give me anything that works. So the pharmacist now brought diclofenac. That was the first one that actually worked. I took one dose of it, and then within an hour or two, 80% of that pain just disappeared. That was when I could actually see. That time I was going to see the pharmacy, I could not see. So by the Monday of it, I went to see the dentist again. I was like, that thing you did won't kill me over the weekend. The dentist now went in and did some extra procedure inside my mouth. After doing it, 95% of the pain disappeared after he did some extra stuff. He now recommended extra drugs, especially for the loss of sensation, which I'm still taking. So I've been managing it. So that's how I'm here. But what do you learn from this? It's up to you, but medicine day, medicine still day. That Oyibo man that told me that they needed extra machine about that nerve, he was right. Baba was right.